but hopefully you're all expecting the nutrition session today, which is talking specifically about nutrition for wound healing and pressure damage prevention. Okay, so let's get into the presentation. So we are talking about how nutrition can impact on wound healing, and just some figures for you there. So there's actually 3 million people in the UK who are at risk of malnutrition. So that's a huge number. And this data was by AHP and BDA. And actually 93% of those 3 million that are at risk are patients who are within their own homes. So that's only leaving really a short percentage a small percentage, of patients who are actually hospitalised or in a nursing home. So 93% of those within their own home. And why is it specifically that nutrition is important for wounds? So poor nutrition will impact on healing time. It can also reduce immunity and increase our susceptibility to infection. So patients who have sort of ongoing wound bed infections, and again, that also in itself, a wound bed infection would reduce an impact on healing time. It's also a risk factor in development of pressure damage. So anyone who is malnourished, has got poor nutrition, it would automatically be high risk of also developing pressure damage. This is because if we've got poor nutrition, it does reduce our tissue tolerance. So thinking about our tissues and the sort of pressure that they can withstand, the more, there's a lot of factors that will affect tissue tolerance, but nutrition is one of them. So the more malnourished you are, that will impact on what pressures and for how long your tissues can withstand that. And so it's increasing your risk of developing pressure damage. And optimizing nutrition, as some people might know, is actually the second most important factor for managing pressure damage. So someone with an active wound that's pressure damage, aside from actually offloading the pressure, optimizing their nutrition is the second most important thing. And I do think sometimes that gets overlooked, and obviously we're concerned with, you know, how we're actually dressing the wound, what pressure relieving equipment there is, but really as optimizing nutrition does need to come to the forefront of our minds as well. Okay, so this is just an Eat Well guide. So this is based on sort of nutritional advice of a general good diet, showing proportions and things. So I've just put a picture up there just to give you an idea. Factors for malnutrition then. So obviously we've said that 3 million people in the UK are at risk of this, and there can be a number of reasons that patients may be more at risk of malnutrition. Could be due to financial difficulty. Maybe they aren't actually able to afford a nutritious, well-balanced diet. Often the presumption or the thought is that eating fresh fruits, vegetables, meat products as well is more expensive, and having that diet, and often people who have got low income tend to go for sort of more processed carbs, starchy foods that will probably keep them fuller for longer, but may not be as nutrient dense. And Carter and Lecco 2018 said generally those with higher incomes were found to be closer to meeting nutritional recommendations, but they did recognise that there are still diets that don't meet the needs across a range of incomes. So although financial difficulty can be a factor, it's not to say that those who aren't financially compromised can still be at risk of malnutrition. Dentition issues, so especially as we get older, we have patients who have false teeth, who may not be fitting correctly, or they may have lost teeth and not actually have any false teeth, so it's difficult to chew, and they may have swallowing sort of issues as well, going outside of dentition issues, but anything like that that could impact on their ability to actually chew or swallow food. Any changes in taste, so I've had patients who have said before that, you know, the food just doesn't taste good to them, and that's why they're not interested in eating it. That can be associated with aging, but also certain medications can affect taste buds as well. Mobility, so again, as I said, the high percentage of patients that are at risk of malnutrition are living at home, and perhaps their mobility is poor and they have no good access or ability to prepare their food. You know, hopefully they've got support from family members or carers, but that's not always the case. It may be something that's not been picked up on, but yeah, just the simple part of them being able to go to the kitchen and get that meal, prepare that meal, is not possible. And mental health as well. So patients with low mood, they may not feel well in themselves, to feel good mentally, to be able to want to eat, to have, you know, that desire to eat a good diet. So that's another big impact. Okay, and hydration. So this isn't just about malnutrition. Hydration is a key thing, because dehydration plays a role in delayed healing as well. We need adequate fluids to maintain dermal water balance. So basically keeping our tissues nice and thinking of those cells nice and plump and hydrated will therefore sort of impact on you know, our skin and its barrier and its integrity. So we are recommended to have 6 to 8 glasses of fluid a day. So keeping hydrated is just important as nutrition. So I'm going to go through some of the kind of the main aspects that I'm picking out in terms of what we're looking at with nutrition, and then we'll go into kind of the assessment and management for nutrition in regards to thinking about wounds. But some of the things that I wanted to pick out that are key is protein. It is a big one regarding wounds because it helps form most body structures and blood cells. It also helps regulate our fluid balance in the body and transport other nutrients around the body as well. The usual requirement of protein for anyone would be 1 gram of protein per kilogram of their weight. Now, when a patient unfortunately has a wound, this need for protein increases, so their intake should then be 1.25 to 1.5 times that usual amount. So, or we may have a patient that is meeting their requirement of 1 gram of protein per kilogram of their weight, but unfortunately if they then have a wound, it does mean then that requirement has increased. So although we may not have picked up on the fact that they are specifically malnourished, it is about recognizing that need for an increase in protein and trying to optimize that in order to optimize their healing. Vitamin C, so another sort of quite a key one when I was doing sort of reading up on this. So vitamin C found in dermis and epidermis of the skin. The aging causes levels to decline, and vitamin C is required for collagen synthesis. So when this collagen production is reduced, it basically will disrupt connective tissue and makes blood vessels fragile. So again, making our skin more fragile, more at risk of breakdown. There has been found to be a higher prevalence in low-income populations. So again, going back to that risk factor, and also smokers have often been found to be low in vitamin C. The use of vitamin C supplements in wound healing unfortunately hasn't shown any consistent results, and it's kind of highlighted the importance of food sources over supplements. So again, you know, these are sort of micronutrients that there are supplements to, but it's understanding that actually it's found that giving the patient these as a food source is probably going to be more beneficial than them taking a supplement. Okay, and so these are available on our website. I will go through the other resources and where to find them on the final slide, but this is basically a table with outlining the role of dietary factors in tissue viability and wound healing. So it goes through some of the key nutrients, some that I've already talked about, protein, which I've discussed, then fat and carbohydrates, vitamin A. So it talks about what their function is, what the effects of the deficiency is on the wound healing, and any sources of this. So it's quite a good thing to kind of refer back to. I did obviously want to talk about some of the key ones in more detail and things that we should be focusing on with our patients and their diet. Sorry, if anyone's got their mic on, could you just turn it off, please, at the top bar, just because I can hear background noise. So if you just go across the top and just press mute, thank you. And so then going on is vitamin C, talks about vitamin E and K, and also iron and zinc. And Pisano and Hillas talked about zinc being important, specifically in protein metabolism, and deficiency is associated with poor taste and smell, and also delayed wound healing. So again, it can have a knock-on effect. So if you're low in zinc and you've got poor sense of taste, smell, that as well might then further impact on you know, wanting to eat particular foods and have a good diet. Okay, let's talk about assessment. So when we have got our patients in front of us, whether they've got a wound or not, think about how we do go about assessing their nutrition. Sometimes, unfortunately, the assessment can be overlooked, or it's not completed accurately or interpreted correctly. So the one that we should all be familiar with and that we use in Oxford Health is the MUST, Malnutrition Universal Screening Tool. It's a 5-step tool. Such tools are recommended by NICE as part of the assessment, but there are, like with anything, there are limitations to these tools. For instance, because the tool uses BMI and weight loss to determine your risk level, it may not actually identify obese patients who are deficient of micronutrients. So a key thing to take away is just because your patient may be overweight, it's not to say that they aren't malnourished. So do pay close attention to that, and in particular when they have a wound, just because they are of a healthy weight, we can't assume that they are getting all the calorie, all the protein, and all the other micronutrients that they need. So that is one of the limitations. And also, from personal use of the MUST tool, I would say another limitation is when you aren't able to determine the BMI with a height and weight. I do think it becomes because you have to use the MUAC, I don't know that it's the most accurate tool, and I think a lot of it we have to just use our sort of own clinical assessments as well, and maybe thinking about other things rather than just an MUAC measurement, etc. The other things that you can consider when you're doing your assessment, so if you are concerned about their nutrition, but potentially their MUST is 0, or you're not able to get an accurate weight on them, think about maybe something like asking a carer or a family member to complete a food chart. So for over a couple of days, get them to list everything that they're eating and drinking, and this can help you gain an accurate picture of what their current protein and calorie intake is. I know it does sound like a monotonous task, but I've had patients where we feel that we've optimized all areas of their care, and we're kind of running out of what we can do, and we've really had to drill down to see what their nutrition is actually like, because on the surface it seems that it's okay, and I've gone and asked carers to complete a food chart and then actually looked at it in detail of the protein and calories, and actually realized that they were getting nowhere near enough protein. So it is, you know, a bit more of a task, and it takes time, but if that's the thing that's going to then boost the healing for that patient, then it's definitely worth it. There is a website, if you Google, it's called, if you put NutriCheck calorie counter into Google, you can basically type in any food or drink and it will give you the calories and protein in that. So it's a really handy way to find out your amounts based on their food chart. Checking blood results as well. There will probably be an argument that it's not the most accurate of you know, indicators of malnutrition. I'd be really interested to just hear if Tracy's got any sort of feedback on that at the end. But basically, in tissue viability, we do check the albumin if there has been a recent one on any patient that's referred to us or that we're looking after. We do look at the albumin, as sometimes a low albumin may indicate poor nutrition. I know it's maybe not the most accurate, but it's just kind of what we use as an idea. And also important to consider that protein is lost through wound exudate. So again, your patient may not be particularly malnourished. It seems they've got a very good diet, but if they are someone with those big wet leaky legs, and they're losing tons and tons of exudate every day, then vital protein is being lost through that as well. So it's very likely that they are malnourished in the sense of them needing increased amounts of protein. So going on to management. So when we've done our MUST and we've done our other elements of assessment, obviously if we have identified that there is a risk, then it's great that we've identified that, but we do need to then be putting a management plan in place. Optimising nutrition needs to be a consideration in all patients with delayed healing. So even if they've got a MUST score of 0, I would really really stress that anyone with a wound where healing is compromised, that we do look at a specific nutrition care plan for them, and in particular when it's pressure damage that's concerned as well. It's really important. And then obviously the obvious side of things, patients who are unable to eat, if their must score is more than or equal to 2, or if you feel that you do need a more specialist support outside of your remit, then do seek advice from dietitians as well. We're not, you know, we can only do so much ourselves. It's really worth asking for help. That's why, you know, we're all a group of multidisciplinary healthcare professionals. The idea is to be able to refer to each other, you know, get ideas off each other. So if you really feel that you're out of your depth, definitely do refer on. It's important though, if you have identified that the patient is malnourished or they're needing an increased level of calories and protein, that you get everyone on board with that. So not only obviously are you aware of that, but your patient is aware of that, and any carers or family are aware of that, just so that we can have a collaborative approach. Because on a usual basis, particularly when it's in a patient that we're looking after who's in their home, we're not there all the time, 24 hours a day, to be able to kind of make sure they're eating certain things at certain times. So it's really getting the family and carers on board, people that prepare, people that help them, may assist them with feeding or give them their meals. If we're all on the same page and all on the same understanding, then we're more likely to succeed in our plan. Consider small frequent meals where food intake is poor, or addition of milky drinks. So a lot of the time our patients, they don't eat 3 big meals a day. Or appetite may be reduced in that they prefer to just eat smaller meals throughout the day rather than sort of the larger meals, and they would decline those. So it's thinking about how we work this rather than just thinking of it as a breakfast, lunch, dinner, just ways that we can add snacks in, or just even a milky drink in between meals. So fortify using milk powder and adding full fat dairy. On the next page I will talk specifically about fortifying milk because it's a big one, but any full fat dairy that you can add to their meals, so milk, cream, cheese, anything like that that could be supplemented into current foods. Make sure that if you can, that they have got good protein sources, so meat, fish, eggs, nuts, anything like that is great. But a big one that I tend to recommend quite often, because especially with patients who do have a small diet, it is a very easy way to fortify and increase calories and protein. So to fortify milk, basically it would be 1 pint of whole milk and 2 to 4 scoops of milk powder. So the milk powder is very cheap. I'm sure you know, a lot of nursing homes are great, and they have that readily available, but also patients within their home, carers and family, are more than happy to go and purchase that, because it's very inexpensive, and also it means we're not having to get them prescribed supplements which are costly, and actually that fortified milk contains more protein than Complan does, so it's actually a better way of fortifying than Complan would be. I often find as well that when patients are given things like supplements like Complan, Ensure, that ends up replacing a meal, so they have that, and then for whatever reason then they don't want their meal after that, so it becomes less of a fortification, and then it turns into a supplement for an entire meal. So with this fortified milk, it can be used in their drinks, so any hot drinks they have, or if they are having something like a milkshake, or if they just like to drink plain milk, or it can be added to their foods, so they can have it on their cereal, in their porridge, added to when making mashed potato, but it can also be added to foods as well, so it doesn't just need to fortify the milk. If you add it to foods with the right consistency, so like soups, yogurts, that can be done as well, and it really does increase calories and protein. Okay, so in terms of further resources, so if you go, I don't know if people are familiar with our website, but if you type Tissue Viability Oxford Health, our website will come straight up, and on there is a resources tab when you scroll down, and then there is a leaflets tab. So this has the three main leaflets for dietary advice that we would advise kind of taking note of, and it's also something that you can give to the patient and carer as well, or file in the notes. The first one not so much, but that's the role of dietary factors in wound healing. So that's the initial slides that I showed that showed all the different micronutrients and how they impact on healing. So if anyone ever wanted to refer back to those, but I would say protein is probably the most key one to be thinking about, and that's what I've obviously covered a lot of. There's the food first, eating well for wound healing, and then the additional info one. Basically what that talks about is ways of fortifying the diet. It also does give a list of foods as well, and protein and calories amounts on that. It's not an exhaustive list though, so that's why I've also added about the NutriCheck calorie counter there as well, because obviously any foods that our patients are eating that aren't on those lists, they can be typed into that NutriCheck calorie counter and you can check the amounts there. Okay, if anyone's got questions, please turn your mic on and then ask the question. But first, actually, could I just ask Tracy, what are your thoughts on, I know maybe we're naughty that we look at albumin as a rough idea, but what is your stance on that? I'm always interested to know, because I do always say in my training, it's just a very rough idea, and that's kind of the best we have when we don't know the patient and we're not seeing them face to face, because obviously these are referrals that we're trying to deal with remotely. But what is your stance on that?
Yeah, hi Lauren. So I suppose as dietitians we generally say it isn't a great, as you've sort of alluded to, it isn't a great indicator of nutritional status. It has quite a long sort of half-life in the body, if that makes sense. So it tends to be an indicator of a patient's clinical status, so how unwell they are, as opposed to their nutritional status. So a low albumin tends to be more of an indicator of sort of the sickest patients, if that makes sense, who then may be at risk of malnutrition. So but it's part, as you said, it's part of the clinical picture, and I wouldn't dismiss it completely. I'm based on OSRA on the stroke unit, so in a more acute type setting. You know, and we'll still get some of the junior doctors going, oh, their albumin's low, can you give them lots of protein, you know, when they're actually clinically quite unwell, you know. So we would tend to sort of bear it in mind on the clinical status of the patient. So if you've got somebody at home who is low weight, has obviously got some sort of weight loss going on, and their albumin is low, then you would bear it in mind. I think it really depends on the setting, but the other one that starts to be used a bit more, but I mean I've not really seen it used, is pre-albumin. So it has a shorter half-life in the body, so it's sort of a more rapid indicator, but again it's still because albumin responds to an inflammatory response in the body, that's where you will get sort of mixed messages from serum albumin levels.
Okay, no, that's great, that's really helpful, thank you very much. If anyone's got any questions, do turn your mic on and ask. Everyone very quiet.
Hi, it's Emily Bishop. How are you?
Hi.
Hi. It was just a point that we did a project about pressure damage and nutrition, and actually I think a lot of people sort of do the Braden without realising almost that actually we've got the nutrition part in the Braden, which then should correlate with the must stuff as well, which I think is really important, that we use these tools, but we use them with each other and holistically.
No, that's great, really great, thanks Emily. Yeah, absolutely. So you know, your Braden already gives you that indicator, and we would say that within that, if you're then thinking that okay, there is a risk of malnutrition, that a must is completed, and then what's, you know, followed on from that. And like I said as well, even if you're identifying, for instance, that must isn't an issue in that it's 0, if you have got someone with active pressure damage, they are still going to need that increased level of protein, you know, they're more at risk, they have more of a special need, I guess. So really trying to explore their nutrition more in depth, maybe, rather than just completing the must alone. You all right, Tracy?
Yeah, sorry, I'm Laura raising my hand. Yeah, it was just to add into that, Lauren, as well. I know the protein has the emphasis, but it's just ensuring as well that the energy is there as well, because the protein can't be synthesized without the adequate amount of energy. So it's just looking at that as again, like you said before, food diaries and things, and looking at the overall aspect of the diets, because you can whack loads of protein in, but if without the adequate energy to synthesize that protein, it's not going to be utilized as well. Okay. So I think it's just making sure that the calories are there as well as the protein for the wound healing. And I agree, a lot of people focus on the protein and sort of zinc or vitamin C and things like that, whereas actually the energy you're getting from the diet is as important to utilize those vitamins and things.
And would you agree that kind of the best way to maybe look at a more in-depth picture would be something like a food chart, where we can see exactly what they're eating and look at the calorie content?
Yeah, food charts and food diaries are great. I mean, we use them all the time on the community hospital wards, and other community dietitians would encourage patients, carers, care homes to do that food diary. I think the fluid diary is important as important as well, as you said earlier. It's easy to neglect that fluid is a nutrient we all need as well. So food and fluid diaries are really good. It just gives you an idea of the pattern, an idea of when they're eating, and also you can then specifically pick out times when you can add that fortified milk or the additions that you recommended.
Yeah, absolutely. That's great. Thank you very much, Tracy. Anyone else have any questions at all? Or anything else you felt you needed to add, Tracy, to that?
No, sorry, me again. You'll regret asking me to come along to this, won't you?
No, not at all. It's really great to have your input.
I think one thing is, I know you mentioned about the fortified milk, and you did mention about supplements. It's just sort of a bit of clarity on the supplement side, in that over-the-counter ones are sometimes quite good. We do have, as I'm sure people listening know, a great reluctance by GPs within Oxfordshire to prescribe the ready-made sort of carton bottled Ensure Plus and Fortisip and things like that. Yeah. However, some of the over-counter supplements are as good. So things like Meriton and Complan, and I think the one is called Nourishment, which are all made with, you can all make with whole milk. So actually, if you find that you don't just need the protein, but you do need those extra vitamin and minerals as well for somebody, then the over-the-counter supplements are a good choice.
Would give you that.
Yeah, I mean, fortified milk is fabulous. We use it all the time on the ward, and it should really be your first line. But if you're needing that little bit extra, or as you said, the vitamins are a bit low, then the over-the-counter supplements would be the ones to go for.
No, that's really great. It's good that there's as well. It's not just instructing family carers that they can go out and buy something like powder. It's giving them other options if they need it as well. Because like you do say, I have experienced the huge reluctance for them to prescribe supplements because of the cost. So it's thinking about ways that we're able to do that for them by other means.
Yeah, and I think most top up type things can be done by exactly the things you said, Lauren, which is adding the extra milk, the extra protein sources, but sometimes people do just need that little bit extra, and those would be the ones to go to first.
Lovely. Thank you very much, Tracy. Is there anything else at all that you wanted to add?
The only thing I'm going to add, which may not be relevant for our population, is about non-dairy sources of that people may be taking more of. So things like soya and rice milk and nut milks, and just remembering they're not as high in protein as cow's milk. So if you're looking at food diaries, it's definitely something to bear in mind, that if people are using milk alternatives, that is something really to look at, and whether they've just chosen to have that, or whether it's an ethical or moral reason they're having it. the protein content can be quite low in some of the milk alternatives.
Okay.
So that is something else to bear in mind.
And would you say, if, say, you know, we had a patient that was on a vegan diet that didn't wish to eat meat or even fish at all, so would you say that it would be a good idea maybe to seek specific advice from a dietitian about how then we can go about fortifying?
Yeah, I think so. I think obviously you tend to find that people who are following, I'm sort of being very generalist here, who are following vegan or vegetarian diets are quite often well up on what they're eating and drinking. They've chosen that way. However, they're quite bulky diets, and if the client isn't getting in enough protein from peas and beans and pulses, then it may be that you need to look at other ways of getting that protein in. And the community dietitians will always give some advice to health professionals for, you know, in that situation, because it might just be just a little bit of additional advice they need to get the protein in. But so it's just bearing in mind what you is harder with vegans, particularly to get in that extra fortification advice.
Okay, fab. Thank you very much, Tracy. That's really, really great.